Hi, my name is Carrie. I'm going to be your nurse today. I'm going to do a quick swallow screening to see if you're ready to start eating. Can you please tell me your name and date of birth?
Sarah, Bella, 6685.
Good, and where are you right now?
Stony Brook Hospital,
And what year is it?
2018.
Very good. I'm just going to have you make a few faces so that I can see how the muscles are working. Can you open your mouth? Good, and close it. Stick out your tongue. Move it side to side. Pucker your lips. And smile. Good. I'm going to give you 90 milliliters of water or 3 ounces. How would you like to drink that? By cup or straw?
With a cup, please.
Can you try to drink it in sequential swallows, so don't move the cup from your lips until you're done?
Okay.
Excellent. I'm going to page your doctor and have him order a diet for you.
Thank you.
You're welcome. The Joint Commission, New York State Department of Health, and American Heart and Stroke Associations require that all stroke patients receive a screening for dysphagia using an evidence-based protocol prior to receiving PO medication or a PO diet. We have adopted the Yale Swallow Protocol. Step 1 is the exclusion criteria. This consists of 6 yes-no questions. Is the patient unable to maintain alertness for testing? Is the patient eating a modified diet due to a pre-existing swallowing problem? Does the patient have a feeding tube? Is there a head-of-bed restriction for less than 30 degrees? Does the patient have a tracheostomy tube? Is the patient NPO for testing or a procedure? If you answered yes to any of these questions, the screening is finished. You may stop and sign the form. If you answered no to all 6 questions, then you can proceed to step 2 of the protocol. This step contains a brief cognitive screening consisting of 3 orientation questions and an oral motor screening in which the patient is asked to close their lips, stick out their tongue, smile, and pucker their lips. It is important to note that the accuracy of patient responses during the cognitive screening and oral motor screening are not scored, and the remainder of the protocol is continued or deferred based on your clinical judgment. You may choose to defer the remainder of the protocol based on patient presentation, including significant facial droop, shortness of breath, or drooling. At this point, you would select Defer and sign the form. Keep in mind, deferring the protocol may delay a patient in receiving PO medication and PO nutrition. If you continue with the protocol, the next step is the 3-ounce water swallow challenge. The patient is given 3 ounces or 90 milliliters of water. The patient is instructed to drink the entire amount in sequential sips. Thus, the patient should not remove his or her lips from the cup or straw. If the patient completed uninterrupted drinking of all 3 ounces of water without coughing or showing other signs and symptoms of aspiration, the patient is scored as a pass. You can then collaborate with the doctor, nurse practitioner, or physician's assistant to order a diet. A patient's dentition should be considered when selecting a diet level. If the patient is unable to drink the entire 3 ounces in sequential swallows due to stopping, starting, coughing, or other signs and symptoms of aspiration, the screening is scored as a fail. The patient is kept NPO, including medication, and a clinical swallow evaluation by a speech pathologist is ordered. If the screening was deferred secondary to decreased alertness or head-of-the-bed restriction, it can be readministered at any time if the patient demonstrates increased alertness or when the head-of-bed restriction is removed. If the screening was scored as a fail, it can be readministered in 24 hours if the patient demonstrates an increase in overall status.